Welcome to the eChart Manitoba Fundamentals session. eChart Manitoba is a key component of Manitoba's electronic health record and is available across the province. The Registry Integrity Unit is a department within Manitoba eHealth that is responsible for the information management services for the provincial client registry. Other Manitoba eHealth initiatives include MB Telehealth, which uses video technology to connect people to healthcare services at a distance. eHealth Hub is a Manitoba eHealth service that provides electronic delivery of lab results and diagnostic imaging reports to Manitoba-approved electronic medical records.
By the end of this course, you will understand what clinical data is included in eChart Manitoba and how it is arranged, learn how to search and filter information in eChart, understand privacy, confidentiality, and security within the context of eChart, and learn about supporting patients' rights in eChart. eChart Manitoba is our provincial electronic health record, or EHR. It's a viewable tool which provides a lifetime record of an individual's key health history. Users are given authorized access in order to use the system. eChart gives you access to information at the right time and the right place. It's an efficient way to access health information in a system that's private, secure, and safe. In addition to our provincial electronic health record, eChart Manitoba, there are other electronic systems in healthcare that you'll want to be aware of. Here's an overview of the differences between them. An electronic health record, or EHR, is a private lifetime record of a person's key health history. It's not a detailed record of every healthcare episode. It's often a search and view only system, and it's a person-centric health record. An electronic medical record, or EMR, is an individual's medical record in digital format. It's used within primary and specialist care clinics. It's an active system where personal health information such as doctor's orders can be entered in by authorized healthcare providers. It's a provider-centric or health organization-centric health record of a person. An electronic patient record, or EPR, is a facility-based digital record containing detailed information such as identification, allergies, and test results. It's used within acute or long-term care facilities. It's also an active system where personal health information can be entered in by authorized healthcare providers. It's a provider-centric or health organization-centric record. Your site determines your access to eChart Manitoba. Each site is responsible for the use of eChart, and each user will accept the terms of use prior to accessing the system. Access is by authorized healthcare personnel only. eChart Manitoba provides a number of different levels of access. Your site will determine who has access, and your site will also determine your security role based on the workflow within your area. eChart roles are unique to the needs of your work role in your facility, not to your labor classification or professional designation. There are a variety of roles that allow different levels of access determined by your site. One of the roles below will be assigned to you by your facility. An individual with demographic view is authorized to view demographic information such as name, address, date of birth, FIN, and gender. Demographic view is required to complete a patient search and is included in all of the security roles. The Laboratory and Reports view provides an authorized user with access to laboratory results and diagnostic imaging reports, as well as all documents under Clinical Documents tab. Medication view provides access to view medication information. The Immunization view provides the user with access to the immunization information. An individual with clinical view has access to all clinical information. An individual with access to clinical view with override is authorized to access all clinical views and has the ability to override a patient's disclosure directive. Clinical View with Override is granted to individuals who are members of a regulated healthcare profession and who also have the ability to prescribe in a clinical setting. One of these two privacy views will be granted to the individuals who will respond to patient requests for access to their personal health information and are most often the site's privacy officer and/or designate. An individual with privacy view is authorized to access all clinical views, and an individual with privacy view with override is authorized to access all clinical views and has the ability to override the patient's disclosure directive. These two privacy roles also give you the ability to see who has accessed a patient's record. If you're changing jobs, changing location, or working at multiple locations, make sure you only access eChart where you've been sponsored. If you're working at multiple locations, you need to be sponsored at each one. If changing positions and moving to another location, you will need to request an account at the new location. The term location could mean department, program, site, facility, or location, depending on the workplace. I'm going to log into the training environment so that we can take a look at what the information looks like in the eChart Manitoba system. But first, let's review some key information on the login screen. You'll find the Change My Password link right below the Login button. The message board will be updated with important information, so please take note when you log in. Users who launch into eChart from their EMR can check here periodically for important information, as they will not see this page. On the bottom of the screen, you'll notice the privacy reminder, as well as a section called Helpful Links over on the right. The Frequently Asked Questions link takes you directly to the eChart FAQs on the eHealth intranet site. When you log into the live eChart environment, the background color on the login page will actually be green, as shown here. I'm going to log into the training environment using a generic login for the purposes of the training session. Up at the top of the screen, you would see your name, and over on the right, you'll see your security role or level of access. For the purposes of the training session, I have Clinical View with Override. This section of the screen is the patient search area. When you hover over a field, you'll see a tooltip which provides data entry information about the field. This field tells us we can include any case type, but we need to include a space between the first and middle names. Let's perform our first patient search by typing a FIN in the FIN field. You can search by FIN only. You do not need to enter a patient's first and last name because the FIN is a unique identifier. We'll learn more about appropriate search methods in eChart in a few moments. Click the Show button on the top right-hand corner of the screen. Enter on your keyboard also works in this section of the screen. When we do a patient search, the system is searching through the Provincial Client Registry for the patient information. Client Registry has about 15 different sources representing over 70 different sites. Here we can see our search results for a patient Colleen Denby. I'm going to click on this plus sign to expand the record. Selecting this record by clicking on the circle under the leading column automatically selects the associated records attached to this patient record. We can tell because each of the records has a check mark beside it in the Select column. Do not deselect any of these associated records because clinical data may be attached to any of these records. Each of these records has come from a different source. For privacy reasons, we can't tell which locations this patient has been to. We can, however, tell which one of these records is the Manitoba Health record. It's the one that has the FIN effective and/or expiry date over here on the right-hand side. This is very helpful when you need to verify the Manitoba health information. As an example, physicians need to ensure that they have this information on their billings, or their billings may get rejected from Manitoba Health. Click on the Enter button on the bottom left of the screen to enter the patient's file. When we enter the patient's file, we land on the Demography Details tab. Up at the top of the screen, there's a blue title bar where you'll find the patient's name, FIN, their age, and their gender. Directly below the blue title bar, you'll see all of the clinical tabs that you have access to based on your security role. On the top left of the screen, you'll see the patient's last name, first name, and middle name. On the bottom left, you'll see basic demographic information such as date of birth, gender, and indication of death. The indication of death field will be populated with a date of death if the patient is deceased. Otherwise, the field will remain blank. Over on the top right is the contact information. There's a little icon called More Contacts. Clicking on that will take you to more contact information for that individual. Here's an important tip. When we move back to the previous screen, make sure you use the green back arrow rather than the Internet Explorer back button up at the top of the screen. If you do accidentally use the Internet Explorer back button, you'll get a page saying, "This web page is expired," and then you'll have to log back into eChart. Click on the green back arrow, and we're back on the Demography Details tab. Continuing on with our review of this screen, you'll also notice there's an identifier section which gives information such as the FIN and family registration number. Let's go back and complete some more patient searches. To perform a new patient search, use the New Patient Search icon, which is the magnifying glass up at the top of the screen. This takes us back to the patient search screen. Over on the far right of the screen, you'll see a hyperlink called Search Tips. Let's click on that. This gives us information on how to perform appropriate searches in eChart. Search by the following recommended unique identifiers. We've already learned how to search using the FIN. You also have the option to use a healthcare number such as other provincial healthcare numbers or other authorities such as Canadian Armed Forces. You can also search using a health or medical record number. If you do not have one of these unique identifiers, you can search by any of the following minimum combinations, such as first name, last name, and date of birth, or first name, last name, and phone number. Scroll through the list to view all your available options. If you wanted to search by one of these combinations, close the Search Tips box and click on the Advanced Search link. Hovering over a field will give you information on the data that is required in that field. To perform a search, populate the fields and click the Show button at the bottom of the screen. If you want to search based on Canadian Forces, for example, select it from this drop-down list, type the number in the healthcare number field, and click the Show button at the bottom of the screen. You'll see that there are other options available as well. For instance, if someone from British Columbia was visiting Manitoba and ended up in one of our Winnipeg hospitals and had lab work done, you'd be able to search for the patient using their BC health number and view that lab work in eChart. Enter their number in the healthcare field over on the left and click the Show button at the bottom of the screen. If you have the security role Clinical View with Override, please do not use the checkbox on this screen, as you will first need to determine if the patient actually has a disclosure directive applied. Review the section on disclosure directives in this course for the appropriate steps in overriding a patient's disclosure directive. You can also search for a patient using their medical record number, or MRN. Click on the MRN search button. type in their number and select the appropriate facility from the drop-down list and click the Show button. When you perform an MRN search, you'll be taken directly to the Demography Details tab. We're going to go back to the patient search screen. As we've been doing patient searches, the system has been keeping a history of the patient files we've accessed during the current login session. If we need to access one of these files again, just click on the link, and the system will take us straight to the demography page for that patient. The system will log you out after 15 minutes of inactivity, but please remember to log out before you walk away from your computer. Regardless of which screen you are viewing in eChart, you will always have access to the FAQ icon located at the top of the screen. This link will take you directly to the eChart Frequently Asked Questions section of the Manitoba eHealth intranet site. Medication information in eChart comes from DPIN, which is the Drug Program Information Network. Any drugs dispensed in retail pharmacies as of April 2010 will be in eChart. This information is updated every 10 minutes, so almost real time. In eChart, we use the anatomical therapeutic chemical classification grouping, which is one way medications are categorized by generic type. If a medication is a new or discontinued prescription drug from Health Canada or an over-the-counter prescribed medication, it will not appear within the grouping. They'll be listed below. Let's take a look at the warfarin as an example. We can see there are 5 items listed below. I'm going to click on the plus sign to expand the record. Let's review the columns. The first column is the date dispensed, then we have the form, the medication, which gives us the brand name, active ingredients, and strengths. The medication column is quite wide, but you can also hover over top of the medication if required, like in this example. Next, we have the duration or days supplied, the prescriber, the facility or pharmacy, and the amount dispensed. Let's take a look at the various filters and other options available at the top of the screen. If we wanted to expand all of the groupings, we could click on Expand All, and Collapse All collapses all records. We also have the option to ungroup the medications by selecting Ungrouped. Once the information is ungrouped, you may want to use the date filters. By default, this radio button is selected, so let's take a look at the information if we were to change this view and request by last 3 months. Make sure to click the Show button after you select your filter values. If we'd like to bring all the information back to the screen again, click on the Show All button. Let's take a look at another filter. We can use the date filter and select our date parameters. We'll select June 1st to July 31st and click Show. Now that you've filtered the information, you may choose to print that by clicking on the printer on the top of the screen. The printer will be colored or lit up to show when printing is available on a particular screen. Make sure you always adhere to your own site printing and privacy policies. The filters at the top of the screen work the same way throughout the application and therefore will not be addressed on each of the clinical tabs. The immunization information in eChart comes from the Provincial Immunization Registry, Panorama, and historically from MIMS, Manitoba's Immunization Monitoring System. This includes immunizations recorded as of 1980 for children and 2000 for adults. On this screen, you'll see the date and the name of the immunization, as well as the person's age they were when they received the immunization. The source column will show as Provincial Immunization Registry as of September the 17th, 2015. Records prior to that date will show as Manitoba Immunization Monitoring System. The Not Given, Reaction, and Route columns are not currently used in eChart. Some historical MIMS immunizations marked as not given or refused remain populated in the Not Given and Comments fields. When you click on an item on the top of the screen, you will see the corresponding details down at the bottom of the screen, such as the physician or facility name. The manufacturer, lot number, and ordered by fields are not populated. The immunization information is updated on a daily basis. You can also print this information according to your own site printing and privacy policies by clicking on the printer on the top of the screen. If you click on the Print Preview on any of the tabs in eChart and you are using Internet Explorer 9, a View Downloads window will appear. Click Open to view the report. This does not apply to the previous Internet Explorer versions. We are currently receiving information from public labs and private labs. Before we review the information on the screen, let's take a look at the Frequently Asked Questions section of our intranet site to view the current laboratory sources as well as the type of lab results found in eChart. Click on the FAQ link. Scroll down to the laboratory section. What laboratory sources currently provide information to eChart? You'll see all of the lab sources listed here, as well as the date we started receiving the information. There's also a listing of the sites that are currently sending results to eChart as part of the DSM Provincial LIS rollout. The type of lab results that we currently receive in eChart are listed on this table. A great place to look for source information is here under What Source Information is included in eChart. Click here to view the source details and frequency table. Let's close the window and go back to the Laboratory Events tab to take a look at the information on the screen. The first column is the Collected Date column. If the source did not supply a collected date, then the lab will appear on the bottom of the very last page as an NA. Next, we have the resulted date. If there were sample level comments, you'd see this icon, and hovering over top, you can view the lab comment, such as sample slightly hemolyzed. Clicking on the report icon allows you to preview the lab results report. And you can print right from this screen by clicking on the printer. Lab results can only be printed one at a time, but you should always adhere to your site's printing policies before printing information. To close any of the reports in eChart, click on the X in the top right corner. The next column is a status, either final or corrected. The corrected status may either be due to a demographic change or a corrected results. Preliminary results are also available for DSM Winnipeg. Next, we have the lab type, the test. Abnormal results are often shown as red. However, you should always review the lab result regardless if they were blue or red. If there was specimen information included in the file, such as blood or urine, you'd see that in this column. Who ordered the test? The facility, as well as the source, DSM Winnipeg in this instance. You have the ability to filter on many columns within the application. Anytime you see this little filter icon on the column header, you can click on that, select your filter criteria, and now we'll see the results ordered by Laurel Smith. You'll notice a little check mark right under the filter, which means the filter has been activated. To bring all of the information back, select All from the filter drop-down. You'll also notice throughout the application some of the column headers have a black arrow. By clicking on the column header, you can change the order from descending to ascending. This patient has 74 different records. We can either select a page number or scroll through the information using the arrows. The date and unit filters at the top of the screen work the same way on all of the tabs throughout the application. We're now ready to review the results, so we'll click on the Collected Date link, which will take us to the lab results view. Please remember that abnormal results are often shown as red. However, you should always review the lab result regardless if they are blue or red. Not all labs send reference ranges and flags associated with the results, therefore will appear blue and require interpretation. On this screen, we'll see the test, the result, the reference range, the status, the facility, and any comments associated with the test. You'll also notice that the test order name appears at the top of the screen. To get back to the Laboratory Events tab, we can either use the green back arrow or select Labs Laboratory from the drop-down menu. When we click on the test link, such as this plasma serum example, we're taken to the test history screen. The test history is a hierarchical view of lab tests for this individual patient. The majority of tests are categorized in the appropriate folder. However, there may be some tests that are not categorized and will be found under the Other folder and listed alphabetically. There are many different ways to view and filter the information on this screen. Currently, we're viewing by collection date, so we can see the collection date in the column headers. The other options available are by orders or by latest results. The by orders view displays a collection date and time in the column header. You'll notice we can see 5 columns at a time on this page, and here we can tell that this patient has 11 different results. Scroll down to the bottom of your screen, and you'll notice a scroll bar at the bottom of the grid. This allows you to scroll over to view all of the results. You'll notice that some of the tests have a red triangle to the right of the name. This is a comment indicator. To view the comment, click on the result link to open the details box. The details box can be moved around by left-clicking and dragging on the title header. You can also resize the box by left-clicking and dragging on any of the window borders. Let's discuss the comment indicator in a little more detail. If there's a comment associated with the test order, such as this one, we would see the information here as we hovered. Clicking on the Collected Date link, we'll also see that comment at the top of the screen right here. Clicking on the test link, which takes us to the test history, we see the comment indicator here, and clicking on the result link, we can view the lab comment in the history details box. This time, we're going to use the urinalysis panel as an example. Clicking on the Collected Date link, we can see that there's a comment at the test result level only, which you see here under the Remarks column. Notice there's no test order comment at the top of the screen. We're back on the test history screen, and you'll notice the comment indicator when we click on the result link We see the remarks here. We're back on the laboratory page. We'll use this plasma serum example to see what it looks like if there's a comment sent at the test order level as well as at the individual test result level. Here's the comment at the test order level, sample slightly hemolyzed, and we'll also see that same comment by clicking on the collected link and viewing the comment at the top of the screen. In the remarks column, we'll find the comment for the test result level. On the test history screen, a comment indicator will appear, but it will be associated with all the tests that are resulted as part of that order. From this view, there's not an additional indicator if there is a lab comment versus a remark. Therefore, you should open each test result in order to see the individual comments. In this example, we see both the remarks and the comments. We'll now continue our review of the test history by reviewing the data tree over on the left side of the screen. There's 4 icons and a show button right above the test names. Select All selects all the tests by putting a check mark beside the test names. We can unselect all. You can also expand and collapse the folders. That's the same as using the plus and minus. If I wanted to focus in on a specific test result, such as the INR, I can unselect all the tests, select just the INR, and click the Show button. The system will bring up the results on the right-hand side. This makes it a little easier to view those results. We can see that this patient happens to have 15 different results for their INR. Clicking on any of the test links will open up the details box and give us the collected date, facility, result, range, date, and time. In this example, the results are abnormal as they're outside the reference range. Please note, reference ranges are not normalized amongst the different lab sources. Close the details box by clicking on the X. You'll notice there's a graph icon located beside the test name. Click on that. And now we'll see a graphical view of that information. Hovering over top of any of the bullets gives you the result, range, date, and time. Although there are many clinical views within eChart that you have the option of printing out the information, you cannot print out this graph. You'll notice that the printer is grayed out or inactive on this screen. If you need to print out a lab result, it can be done from the Laboratory Events or the Lab Results tab. Remember to always adhere to your site's printing and privacy policies. One other option for filtering the data is by using the search box. Let's say we wanted to search for glucose. Type it in the search box, click Enter on your keyboard, and you'll notice it's highlighted in green below. We can scroll through the tests that contain the word glucose by using this down arrow or the down arrow on your keyboard. Select the test and click Show. We can also just type in the first couple letters, such as CRE. In this instance, it brings up creatinine. Put a check mark beside the test and click the Show button. If there's lots of information on the screen and you're finding you just want to focus in on the lab results grid, there's a small arrow here which can collapse the left pane. Click the arrow again to expand the pane. There's also an arrow here which can be used to collapse and expand the upper pane. You can also left-click and drag on this gray border to expand the left pane. Although the microbiology tests are referenced on the Laboratory and Test History tabs, the result is found on the Clinical Documents tab. For instance, if you're viewing this test on the lab results screen, you'll see the comment, "See Clinical Document for result details." This means you'll need to click on the Clinical Documents tab in eChart and view the results on this tab. There's a few sorting options available that you may want to use, such as Author, Date, or Facility, as well as an Expand All and Collapse All button. You can also expand and collapse by using the plus and minus. Diagnostic imaging reports have been received from November the 3rd, 2011 from the majority of the province. Based on the previous regions, this would include all regions except the former Assiniboine, Brandon, and Central. Only reports which have been dictated, validated, and electronically signed by a radiologist will display in eChart. Reports will display as final unless an addendum has been done to provide additional clinical information. In that case, the report will display as corrected. Here's an example of a chest X-ray. As you see, this information can be sorted by modality, ordered by, date, or facility. The imaging details are found at the bottom of the screen, as well as on the print preview.
Encounter information has been received from St. Boniface Hospital since November 3rd, 2011, and from other connected provincial ADT EPR sources from July 2016 onwards. Visit the eChart Encounters FAQs for more details. On this screen, we'll see the admission date, the type of encounter, facility, the attending provider, the discharge date, as well as where they were discharged to. The encounter ID is the visit ID in the electronic patient record at the facility.
The summary page provides you with a quick overview of your patient's information, including up to 4 encounters, a maximum of the 50 most recent medications that are in the system for this patient, as well as any lab results within the previous 1 month. The section headers will provide details as to what other clinical information may be available for this patient. The header will say, "There is no data available," meaning the patient does not have that type of information in the system. "There is no more data available," meaning all of the information that this patient has for medications is shown on this summary tab. Or, "More data may be available." You may see this particular message like here in the Labs section, because by default only the labs within the previous month will display on the Summary tab. Lab results that are older than 1 month will be on the Laboratory tab. Clicking on the Collected link will take you directly to the lab results, and clicking on the Test link will take you to the test history. On any of the tables, if you click on the See More Data icon, you will be taken directly to the information on the Clinical tab. To get back to the Summary tab, either use the green arrow or select Summary from the drop-down. One important thing to note about security roles on the Summary tab is that all tables for all roles will appear on the Summary tab, but results will not populate unless you have access to that information based on your security role. As an example, if I'm a user that has Clinical View, you'll notice that the Medications grid is populated with medications. Using that same patient as an example, if I have the role of Laboratory and Reports View, I can still see the table, but there are no medications shown as I do not have access to medications based on my security role. I don't see the Medications tab in the system and therefore do not see the information on the Summary tab either. The only exception to the information we just reviewed about the security roles is for the demographic role. They do not even see the Summary tab. They will only have access to the Patient Search and the Demography Details tab. The Annual Review tab is a color-coded calendar which provides you with a 3-month snapshot of your patient's encounters, lab reports, and diagnostic imaging reports. We can quickly see that on July 15th, this patient has laboratory and diagnostic imaging results in the system. Clicking on the date will take us directly to a daily summary for that patient. And remember, you can navigate back to that page by clicking on the green back arrow. This page also allows you to scroll backwards and forwards 3 months at a time, or by selecting a date at the top of the screen and clicking Show. Information in eChart Manitoba is secure. Measures are taken to ensure privacy and confidentiality of information. Information is transmitted and stored securely. Information access and acceptable use policies are required. For instance, FIA pledges are an example of an information access requirement. Terms of use is an example of a policy that's in place. Standards of professional practice are in place, and system checks and balances are enforced, such as audits, reviews, and disciplinary actions. The source systems for eChart Manitoba are responsible to ensure the information they provide is correct, current, and complete. Keep in mind that eChart is a view-only system, and therefore corrections and/or updates to information must be initiated by the source. If information updates are required, the changes will appear in eChart once the source has sent the correction or update. eChart does not notify users directly. The eHealth Service Desk facilitates corrections with eChart source systems. Here's some important information about your responsibility and accountability in regards to the use of eChart Manitoba. Activity in eChart Manitoba must support patient care. You're responsible to use only minimum amount of information on a need-to-know basis. Do not look at your own information in eChart. You are accountable. All activity will be monitored, tracked, and subject to auditing. In addition to not looking at your own information in eChart, here are a few more examples of when you should not access eChart Manitoba. If the person is not currently in your care, to view the records of your colleagues, family, friends, neighbors, or other personal relationships, either current or former, and do not use eChart for research, chart audits, or other forms of secondary use. Protect yourself and your patients. Always log out when you walk away from your computer. Do not share your user ID and password with anyone. You are responsible for all activity under your username. This section covers supporting patients' rights with eChart. Here's an overview of what we'll be discussing. Individuals have the ability to view or receive a copy of their information, see who has accessed their eChart record, and limit the disclosure of information within eChart. Patients have the right to view or receive a copy of the information contained in the eChart Manitoba system. Clinicians can turn the screen so that the patient can view the information, print the information immediately in accordance with existing site privacy policies, or provide the individual with the information to go through the eChart Manitoba services request process. Individuals have the right to see who has accessed their information. Whenever a healthcare provider views a patient's record in eChart, a record of their access is logged and will display in an audit report. To support a request for a record of user access from eChart Manitoba services, visit the website where you'll find the patient forms. Individuals can limit the disclosure of their information. They have the ability to place a disclosure directive on their eChart record. A disclosure directive in eChart is an instruction that an individual gives to prevent their own information from being disclosed, viewed, or printed. It's an electronic mask that is applied to all of the patient's clinical information. It hides everything but the demographic information. To apply or remove a disclosure directive, contact eChart Manitoba Services by visiting our website. Only clinicians with the security role Clinical View with Override are able to override the patient's disclosure directive. When they override the disclosure directive, they will receive this error: "You are not authorized to access this patient file. In the event of an emergency, flag override consent and try again." Over on the right, we can see the reasons for override. We'll take a look at what this looks like in eChart in a moment, but before we do that, let's discuss a few key concepts in regards to overriding disclosure directives. Rationale is required prior to access. If possible, ask your patient for their consent. If you would like to provide supporting text for your reason for override, you may want to consider selecting Other as the reason. You may choose to document the reason in your local EMR. Access is limited to the authorized user. Access is only valid for the current login session. An alert is triggered for audit purposes. Let's take a look at what disclosure directives look like in the system. There are two access roles that have the ability to override a disclosure directive in eChart: Clinical View with Override and Privacy View with Override. These roles are only granted to members of a regulated healthcare profession who have the ability to prescribe in a clinical setting, or a privacy officer. I have Clinical View with Override for the purposes of today's demonstration. First, let's discuss how you can determine if the patient has a disclosure directive. Type in the FIN and search for your patient. Select your leading record and click Enter, and the system takes you to the Demography Details tab. This means that this patient does not have a disclosure directive applied to their record. We can also see the clinical domains that are available at the top of the screen. On the other hand, let's try another patient. Select the leading record and click Enter. This patient does have a disclosure directive. And we know that because we automatically receive this error message saying, "You are not authorized to access this patient file. In the event of an emergency, flag Override Disclosure Directive and try again." Close the message box. Now that you know the patient does have a disclosure directive, in order to access the patient's clinical information, you'll need to check the Override Disclosure Directive box and enter the patient file again. This time, you'll be prompted to select a reason for override. You may wish to select one of the options provided for overriding the patient's disclosure directive, or select Other, and use this opportunity to document in your own words the supporting context for why an override was performed. Keep in mind that the patient may request at any time in the future to know who has seen their eChart record, and you may be asked for the reason why you entered the chart. We'll select Other and type in supporting text. Once you've selected your reason, click OK. Clicking the OK button will trigger an alert to eChart Manitoba Services. You will now have access to all of the clinical information for this patient. Your override of this patient's disclosure directive will remain in place throughout the current login session. As long as you do not log out of eChart, you can search other patients and still return to the clinical information for the patient with the disclosure directive by clicking on the patient file history link at the bottom of the patient search screen. This will not trigger another alert. However, once you've logged out of this current session, if you wish to return to the patient with the disclosure directive, you will have to repeat the override process. This will trigger another alert to eChart Manitoba. It is important to note that an alert is sent to eChart Manitoba each time you check the Override Disclosure Directive box. This alert happens whether the patient has a disclosure directive or not. It's the act of checking the override box that triggers the alert. If you check the override box when a patient does not have a disclosure directive, this results in a false alert. For each alert, an eChart Manitoba privacy analyst will review the override. To log out of eChart, click on the Logout link on the top right corner and click on the X to close your browser. Your patients can find request forms and learn more about eChart Manitoba by going to the Public Access website or by contacting eChart Manitoba Services. As a healthcare provider, you can find additional request forms, FAQs, handbooks, and news updates, and access the e-learning online course on the eHealth intranet site at this address. If you have questions about eChart, contact the eHealth Manitoba Service Desk. Congratulations on completing your eChart training. Please complete a short course evaluation for us by typing this address into your browser. We appreciate your feedback.